Hey guys, it's Dr. Clemens of Novus Medical Spa. This time I'm the patient. We're sitting here getting ready to undergo a microneedling. We have a new microneedling device, a skin pen. We've been doing microneedling for about 4 to 5 years. It's a beautiful way to resurface the skin with minimal downtime. And what do I say minimal downtime? Well, we're going to go ahead and treat me, do a full face for photo damage treatments and anti-aging treatments. And we'll go ahead and put some cream on afterwards. And tomorrow night I'm going to be at a black tie event. I'll be at the Kingsport Chamber of Commerce event at the Meadowview in black tie, and having being 24 hours out from a full face microneedling. So you really don't need to miss any work or any time for it. But a series of these once a month will do a beautiful job of resurfacing the skin, getting rid of the damaged collagen and elastin, getting healthy, fresh, young collagen, just taking years of lines away from you. This month is Love Your Skin Month, so this is part of it. So you need to come on in to see if you're a candidate for it. This beautiful lady beside me, behind me now, that's going to treat me is Kelly, and most of you know Kelly, but she's going to treat it. She's going to do some talking. I'm going to sit back and become a patient. Let's do it, yes.
So Dr. Clemens, is this going to hurt or have you been numbed prior?
I've been numbed. We put numbing on me about 45 minutes ago. We have a beautiful numbing cream, BLT cream, and we let it sit for about 30 to 45 minutes and then cleanse the skin. Kelly has done a nice little hot wrap on me, a little steam, and we've gotten everything off, the numbing off, so she's now putting a gel on that we're going to microneedle in. She's going to start the microneedling, but I should feel minimal discomfort. Even though we're going to be going with multiple needles in the skin, it's minimal discomfort. So we're going to start now, and I'll be quiet at this point so you can kind of see what's going on. There is zero pain. On a scale of 1 to 10, with 1 I don't feel anything, 10 it hurts. I'm about a 0.05. I mean, there's just nothing here. So no pain, no discomfort. I sort of feel guilty. I mean, you have such a great result and not have to suffer for it. But this is a new generation of the microneedling pens. It's FDA approved, it's sterile, and you can't cross-contaminate, so you can't get one person's blood products onto your skin. The device will not allow that. There are not many out there that let you do that. This is one of them. So it's about a 20 or 25 minute procedure. We'll do about 5 minutes on mine, and then we'll hang up, and then we'll come back on when I'm finished so you can see what it's like. But I think Kelly wants to talk about this a little bit. So Kelly?
So Kelly, what's the difference in this pen and the pen that we were previously using?
The skin pen has fewer pens per cartridge, which allows for each pen to actually make a clean puncture. When there are more pens in the cartridge that are closer together, it can be more traumatic to the skin. So there are less pins, but each pin is moving up and down at a faster rate. So you're still getting the same amount of controlled trauma to the skin, which is what we are trying to achieve, but we're doing it with less irritation to his skin. So Kelsey, if you want to come a little bit closer, you can see what I'm looking for. I want to get to the dermal-epidermal junction of the skin. That's where collagen production occurs. I can't tell that by looking with my naked eye. So what I'm doing is looking for just this slightest little bit of pinpoint bleeding. That tells me I got to the depth of his skin that I need to be at to initiate collagen production. So this is what we're looking for. We're looking for consistent erythema, which is redness all over, and just the slightest little bit of pinpoint bleeding. We don't want to see a lot of trauma to the skin.
So what's the difference in downtime with this pen versus our other pen?
It's going to be similar, really. Most people will start to feel dry and tight in about 24 hours. They'll start to peel about day 3 if they peel. Most people will experience some flaking and peeling. That flaking and peeling can last for about 3 to 7 days. It depends widely on the individual. There's really no predicting factor about how long you're going to peel. But that peeling process is what gives us the nice glow. It removes some of the brown pigmentation that we have on the surface of the skin. It also helps refine the pores. So that's kind of the immediate gratification that we get from microneedling. The long-term benefit that Dr. Clemens was mentioning earlier is the remodeling of the collagen. So we're fixing broken collagen, damaged collagen. It kind of gets mangled up from sun damage, lifestyle, those kinds of things. And we're also giving a surge of brand new collagen. And that takes about 3 months to occur. So we like to do these in a series of 3 treatments, 1 month apart. That times nicely with the collagen production cycle. We don't want to damage that new collagen while it's being produced, so we make these controlled injuries, and then we give it some time, give your skin some time to do its own work. So this is kind of what we're looking for.
What about makeup, Kelly?
These channels can stay open for up to 48 hours. Most of the channels that I'm making will close within 10 minutes, but in some individuals, they've been shown to stay open up to 48 hours. We really would like for you to not wear anything that, if you need to do a little bit of coverage, if you can wait about 24 hours and maybe just do a mineral, like a powder mineral foundation, something like that. Just want to kind of baby our skin.
Should I use any skincare afterwards?
With the skin pen, it's recommended that we use a product that has either magnesium, copper in the product. That has been shown to, that one of those minerals is necessary in some form to help the healing process, and you produce better quality collagen. We offer products here in-house that have those. A copper peptide or something with some magnesium, or even zinc actually, is also an acceptable mineral. But we just want to make sure that you're applying that for about a week. And that will give the mineral base that we need for that collagen production cycle. Other than that, we just want to use a nice gentle cleanser. We want to stay away from glycolic acids or retinols or any of our more aggressive, like serums and things like that, and let our skin just have a little time to do its work. We're giving it a really nice workout today, and we just want to give it time to recover and get back to its standard state. So I typically say about 5 to 7 days is when you can resume your anti-aging skincare regime. Would you agree with that, Dr. Clemens?
Yes, absolutely. Pain-wise on this, I may have gotten up to a level 1 with a 1 out of 10, maybe. I mean, it doesn't hurt. You could actually go to sleep during this.
Some people do go to sleep during it. About if there's their second or third microneedling and they kind of know what to expect, their mind relaxes and they can kind of zone out and just enjoy their spa treatment.
Yeah, it's sort of like I said before, I sort of feel guilty laying here, knowing all the work that you're doing and all the repair my skin's going to be done, and I don't feel like I'm doing anything.
Well, one of the great things about this particular device compared to the one I've used before is that this one has actually a microchip in it, so it's continuously adjusting to the tissue, to your particular skin tissue in the exact area that it is treating at that moment. So it kind of takes a lot of the guesswork out of it for me too. So I'm doing a lot less work than I normally would have been doing with our old device, Dr. Clemens.
So this is a smart pen.
Yes, a smart pen. just to make a comparison, I'm kind of in my own mind comparing it to an iPhone versus a flip phone. It's just a very, very smart device. So I'm making sure I make multiple passes over every single area of the skin. Here you can see that little tiny bit of pinpoint bleeding that we're looking for. He has some pigmentation on his cheeks here, so we hope that we can lighten that up for him. This late winter window of the year is a great time to do this. You really want, it's very important to avoid sun exposure when you've had microneedling, because your skin has shed its protective SPF umbrella, which is all the dead skin cells that lay on top of the skin. So when all this flakes off, it's lost its natural protection factor. So it's really important to avoid gardening or going to the ballpark with your kids or mowing the yard or anything like that while you're undergoing a series of microneedling treatments. You just have to be very, very careful not to get any incidental sun exposure. Walking across the parking lot, in the car, all those kinds of daily activities, we get lots of little bits of sun exposure, and you're really prone to getting additional pigmentation if you're not really taking care of your skin. So these short days, dark, overcast, dreary, rainy days like today, now's the perfect time of year to get your series of 3 treatments in.
All right, so now I'm gonna come back in probably 15 minutes and we will see what Dr. Clemens is looking like.